In this video, we're going to discuss aging of the mid-face and lower eyelid. This often presents as eyelid bags or a hollowness or tired look that derives from bagging of the eyelid and a fallen cheek. Lower lid and mid-facial aging is a problem that typically occurs in the late 30s and early 40s onward, although I have seen some unusual examples of young people in their 20s where the lower eyelid has bags and the mid-face has very little volume. The main characteristics of mid-facial aging include eye bags, an empty cheekbone, and a fallen cheek. The fallen cheek gives rise to nasolabial lines, which are a heaviness that sit from the nose to the corner of the mouth. This is often an area people choose to target with fillers, but the fundamental problem is not the heaviness around this area, but the cheek itself has fallen off the cheekbone and descended down the face. When you couple this with an empty cheekbone and then an eye bag, which sits rather lonely in the lower and mid face, then you get a significant impression of aging. If you think that this is a problem that affects you, then your consultation will involve a discussion of what you see in the mirror, what you have tried already. Mid-facial aging is often addressed in the early phases by filler to replace the lost volume over the cheekbone. If you try and use filler in the middle to late stages, then what it creates is a double bubble type appearance where the cheek has fullness created by filler, but the real cheek has fallen down the face, creating a second fullness around the nasolabial area. Mid-facial aging is often addressed in the early phases by filler to replace the lost volume over the cheekbone. Another way people often try to treat mid-facial aging is by thread lifting. This has the potential to improve one or two of the three signs of facial aging, namely, it can raise the fallen cheek and thereby cover the exposed cheekbone. The problem with thread lifting, however, is that it is designed to be temporary. The threads often dissolve after 6 to 12 months, and this, in the vast majority of cases, leads the mid-face to fall again. The other problem with thread lifting as a treatment for this particular problem is that for the vast majority of people, the reason why they seek treatment is because of the eye bag. The tear trough or exposed cheekbone area and the fallen cheek often comes as somewhat of a surprise to patients. We will also discuss your general fitness for surgery, whether you take any medication, also your eyesight, whether you wear glasses or contact lenses, if you suffer from dry eyes. The discussion around lower lid blepharoplasty, which in my practice almost always includes a mid-face lift because of the reasons we've just discussed, involves a general anesthetic. The general anesthetic is followed by a small incision under the eyelashes. We then reach down under the fallen cheek, mobilize the cheek. We repair and reinforce the orbital septum, tighten the muscle in front of the orbital septum, and then we place the mobilized cheek right at the rim of the orbit, essentially the edge of the bone in which the eyeball sits. This is restoring the cheek to its original place. It also restores the natural look where the eyelid is flat or even ever so slightly concave, and the eyelid also flows neatly and seamlessly into the cheek. It will further reduce the heavy nasolabial lines and bring an overall freshness to the mid-face. The operation typically takes an hour to an hour and a half. Complications of lower blepharoplasty with mid-face lift include swelling and bruising, which are inevitable. These will typically persist for 1 week, but may last as long as 2. There will be swelling and stiffness, not only of the eyelid where the scar sits, but also of the tissues below the eyelid. Remember, the mid-face lift part of the surgery is much more extensive than the very small scar under the eyelash. As a result, you will look swollen and bruised for at least a week to 2 weeks. Going out in public with a mask would be easily done, but going to an office where people will be looking at you closely is challenging unless you tell them exactly what procedure you've had. Other complications include infection. This is rare, but it is actually quite a serious complication for this operation. The problem with creating scar tissue is that as it heals, it contracts. If we create scar in the delicate soft tissues around the cheek and the lower eyelid, then as that scar contracts, it tends to pull all of those tissues into the center. This means that the lower eyelid can be pulled down, and in fact, it always is in the early phases of this surgery. There are some techniques we employ to try and counteract this. We place a special internal splint stitch made of dissolving material called a canthopexy. We also firmly fix the cheek to the bony rim of the orbit. This keeps it supported and high. In my practice, I also affix a sponge bolster. This, although looking strange, is a key addition to the surgery. What the sponge bolster does is support the cheek against the rim of the orbit. It also minimizes swelling and potential bruising. It also supports the lower eyelid against the early contraction that we discussed. The sponge bolster is removed at 1 week, but be aware that everybody, for the first week at least, and often for 2 to 4 weeks after, will have some degree of lower lid swelling, stiffness, and malposition. In addition, the lower eyelid acts as a windscreen wiper for the eyeball. It complements the upper eyelid. It also stores tears, cupping them against the eyeball, allowing the lower eyelid to wash them over before they drain close to the nose. If I operate on your lower eyelid area, then the lower eyelid windscreen wiper tends to be less effective until the stiffness and swelling subsides. This can be from 2 to 4 weeks typically, and supplemental eye drops may be of benefit. Things that we can do to speed up the improvement of the lower lid position include massage and tape. We will review you regularly until we are sure that the lower lid position is going to return to normal. Be aware, the last few fractions of a millimeter of the lower lid return can take many weeks or months and may lead to a very subtle change in your lower eyelid appearance, which can take some time to improve, or in some cases never improves, but tends to be extremely subtle and only noticeable to you on the close examination. Following lower eyelid surgery, the scars, swelling and bruising typically settle after 2 weeks. At this point, you could go back to work or go to the shops or to dinner with friends. Exercise, especially if vigorous, should be left until 3 to 4 weeks. We also recommend you don't put eyeliner on the lower eyelid, as the scar sits immediately below the lashes. The eyeliner may get in the scar unless completely healed. Overall, the satisfaction from lower lid blepharoplasty with mid-facelift is very high. The key thing to note is that the improvement is often subtle. It's noticeable to you, but your friends and family will typically say, you look fresher, you look brighter, you look well rested. They won't specifically notice that you've had surgery to the lower eyelid area. For the vast majority of patients, this is a bonus and exactly what they're looking for. Should you have any additional questions about lower eyelid surgery, the complications, or the recovery, then please get in touch with us here at Adam Goodwin Surgery. We'd be very happy to book you in for a free consultation to discuss how the operation may be able to help you.